and welcome to another edition of ISG Smartalks, the podcast that looks at how technology is changing business and transforming entire industries. Our objective, as always, is to educate, to inspire, and to entertain. And despite this being a somber time, for obvious reasons for many, we'll endeavour once again to achieve all three of those objectives in today's discussions. Now, in our last episode, we looked at ways that businesses impacted by the current coronavirus pandemic could cope, could survive, and even thrive during what is an unprecedented time of economic uncertainty and stress. And during this lockdown period, just as many of us are focused on doing to our own bodies, we discussed how it's possible to use this time to get your business lean and fit, to reduce unnecessary technology costs and streamline and digitize operations. And today we want to take a different perspective and look at how a specific industry is being impacted by the COVID-19 virus. Now, the virus is undoubtedly having a huge impact on many industries, and some are obvious, such as retail and leisure, with shops and bars and restaurants and theatres, cinemas, gyms shut across the globe and millions of employees furloughed, or travel and tourism with airlines grounded and hotels closed all over the world. Now, one industry that's core to the pandemic and which is impacted in a variety of ways is the healthcare industry, and that's what we're going to be discussing today. And given the subject matter, that our health is being dramatically impacted by the virus, much of it in very negative ways, as of today, sitting here mid-April, we've got over 2 million COVID-19 cases and 135,000 very sad deaths so far. But as well as the negative implications, there are also some positive implications. For example, many of us, as I mentioned earlier, are using the opportunity to keep fit and improve our health, and the focus on ill health right now may actually encourage us to lead healthier lives over the longer term and will lead to expansion opportunities for the healthcare industry potentially. And the healthcare industry is obviously key to developing coping mechanisms. It's linked to medicines and even vaccines. From a supply chain perspective, it's likely to see significant demand and focus. So to help me unpick the industry and the impact of COVID-19 on health are two experts in the field. So I'm delighted that I've got Bob Krohn and Jamie Burke, both partners at ISG and recognized healthcare and technology experts, with me to discuss this. So, gentlemen, welcome to the podcast. Can you please introduce yourself to our listeners? So, Bob, why don't you go first, and then Jamie, you go next.
Sure. Thank you very much, Barry. My name is Bob Krohn, and I head up the ISG healthcare practice. What that entails is developing go-to-market strategies, pursuit development, and overseeing various deliveries into the healthcare sector. Briefly, ISG defines healthcare as payors, providers, PBMs, and healthcare solution providers, and we'll unpack those terms later on in this podcast. I've been in this role now for 5 years. I've been with ISG for 10, and very pleased to be joining Barry today. Jamie?
Absolutely. Very pleased to be joining you as well today. Jamie Burke. I've been in the IT industry for going on 20 plus years now. Spent the last 6 of it with ISG in the healthcare and pharma life sciences spaces, where I've literally been in the basements of large organizations, helping them with a lot of their IT sourcing and transformation projects. Been working with Bob now for about that time, 5-6 years. Happy to be with you today.
Brilliant. Well, thank you, guys, and a very warm welcome to the podcast. Now, let me start with what's maybe a very basic question for you, but for some of our listeners who may not be as au fait with the healthcare industry, and I suppose from myself as a consumer of the healthcare industry. It sounds like it should be a relatively simple industry at a high level when you think of it sort of caring for our health. But in reality, I think it's a pretty complex industry with a large number of different moving parts to it, which varies by geography. I know, what we have in the UK with our National Health Service is very different to the healthcare industry in the US. So can one of you bring it to life for our listeners? When we say healthcare industry, what are we talking about exactly?
Sure, I'm happy to take that one. And you're right and you're wrong. It's not so easy to define the industry. There's various definitions, and it is somewhat complex. But the generally accepted definition that ISG follows is we break the broader ecosystem, if you will, into two different categories. One is called healthcare, which we'll spend most of our time talking about today, and that includes healthcare payors, so large insurance companies, providers, hospitals and hospital chains and such, pharmacy benefit managers, which is a kind of an expiring term, but we'll talk about that in more detail too, and healthcare solution providers, also called healthcare tech companies. So that's the healthcare industry, if you will. A complementary industry, very much integrated, is life sciences. And in the life sciences category, we put companies like Big Pharma, so Novartis, Sanofi, Merck, Bayer, and others, medical device companies such as Abbott and Medtronic, and large distribution companies such as McKesson and Cardinal Health. So again, certain experts will differ on the components of these sub-industries, but basically that's how we separate healthcare and life sciences.
It is interesting, it's very different in the UK, because we have this national health system. To most of us, sort of consumers of it, we think of it as pretty straightforward. I know it's not, and it's a very complex supply chain, and many of the organizations you mentioned are global, and it's an industry which is going through, and certainly in the UK as well, huge amounts of change. Technology plays an ever increasing role. The amount of data we're collecting is increasing. Trying to measure health outcomes is being transformed by the data which we're now collecting, and we see that every day actually with the COVID-19 data that is being presented to us by the government. But maybe we'll come on to data and technology a little bit later. But as it is such a huge industry, do you know globally from a revenue perspective or number of people employed how large the industry is?
I do, yeah, Barry. Jamie here. So the global healthcare market, right, it reached a value of about $8.5 trillion in 2018, and it's had a compound annual growth rate of about 7% since 2014. That growth rate is expected to grow to somewhere between 8 and 9%, and then the overall market should be about $11 trillion by 2022. So it's big and it's growing, and it employs roughly 60 million people globally. So large and complex.
Absolutely, and very important. Let's talk. We'll move on to COVID-19 in a minute, but let's think about the industry pre-COVID-19. What were the major themes and trends, if you like, that we were seeing in the healthcare industry before the pandemic hit?
Absolutely. So I just told you how large and complex it is. Well, there are many themes that have been out and about, but I'll try to summarize them here. So clearly, there's been a drive towards the personalized, data-driven healthcare, right? Patient centricity, being smarter about our health, right? And then we'll talk a little bit more in a minute about the trend towards value-based care. Telemedicine took hold of late, and now obviously we see the acceleration with what we're dealing with now with COVID-19. That's growing exponentially and probably will continue to do so. There's been the use of public and private data where things we've been trying to move that, smash that together, right? And a lot of that was originally for tackling overdosage challenges. And obviously now there's an interest with pandemics and other diseases. Regulation, especially in the U.S., we kind of talked about it. It's continuing to evolve, right? That requires a lot of compliance investment from a lot of the ecosystem players. Talent development, just bodies and smart individuals that know how to support the technology, the changes, the healthcare management, the aging population. Payors, right? We've mentioned them. They have an opportunity to continue to drive efficiencies, right, through a lot of tech investment and different business model changes. We think that what the payors look like now will be a totally different thing in 5 years from now. Precision medicine has been getting a push. Artificial intelligence has been doing wonderful things in the industry. Cybersecurity. So there's been an explosion of technology wrapped around gathering data, health data, our smartwatches, you name it, different monitors, diabetic, wearables, you name it. So there's tons and tons of data, and we'll talk more about data and that. But the cybersecurity wrapped around all of that, right? We've seen the Internet of medical things, right? There's a lot more monitoring going on of folks in homes being monitored by faraway call centers and that sort of stuff. Yeah. Cloud computing started to take a hold. And then with cloud computing, we've seen the tech giants entering the market, and we'll talk some more about that as well. With a view of the value-based care, right, being a top priority that we'll talk a little bit more about later on, but payors, right, will be focusing on care delivery systems, right? We've clearly seen, based upon regulations and some of these other trends, that in the U.S. there's been a big shift of services out of hospitals to ambulatory care and surgery centers. That's been growing. What we call ARC, or automation, robotics, and cloud, right? That phenomenon has created opportunities for digital savvy disruptors, and we're seeing them enter the market. Paperless real-time data, right, and tons more of it, right, is leading to this more personalized care. And this data is of incredible interest to many of the ecosystem players, the providers, the payers, the tech giants, you name it. There's obviously increasing spend and lots of investments by startups, tech giants, and IT service providers. Med tech companies are changing their approach to more service-oriented services. There's interesting market alliances that Bob will probably talk to here in a couple of minutes. And then just from a service to the end user, right, or the client of healthcare, right, there's obviously a growing, aging, and more chronically ill populations around the world, right? And then has always been, and we really haven't solved the challenges with access to and affordability of proactive and adequate care. So those are a lot, but this is a large, complex market. But those are some of the trends pre-COVID-19, and you'll hear us with some modifications here in a couple minutes.
Yeah, no, thank you very much. Again, really comprehensive answer. And when you think about many of the things you said are commonplace across industries, right? The use of cloud, the use of process automation, which you can so see in the healthcare industry with so many complex processes, and of course there's such a huge customer base of the us humans globally, and you can see there are certain parallels across different industries of what other industries are going through. And the whole IoT is interesting for me. Actually, my father, who is not very technology savvy, and is an old retired farmer, he's got a defibrillator on his, I was going to say installed. I don't know whether you install it on your heart, but he's got a defibrillator fitted because he'd had a heart attack. And his doctor monitors his heart remotely, and has been doing it now for probably 10 years. It was the first time when my dad had that fitted, I really thought, oh, look how health technology can play an important impact on health, being able to do that remotely. But it also made me think about the security implications, because he's effectively just another node on a network, right? You could theoretically be open to security implications the more that we see technology embedded in humans. But so it's fascinating stuff.
Barry, if I could, Barry, real quick. So I had the privilege of sitting in on a medical research firm and a fund, and the gentleman that had driven a lot of money towards this effort was addressing, a non-common cancer that his wife had, and the incredible things going on in the industry about the data sharing and the AI and the therapies being developed to treat cancers. It's an incredibly exciting and innovative place to be. So there are big challenges in the market, but there's also just amazing stuff going on. Sorry, I interrupted.
No, that was great. God, if we can use technology in the right way to, find a cure for cancer, there's got to be the right focus for us to apply our minds and the latest technological thinking. So It's an exciting industry to see those technology developments in. You talked about value-based care, which is something I'm not particularly familiar with, and patient outcomes, which I know a little bit more about. But what do we mean by value-based care, first of all, and is it possible to measure patient outcomes in a consistent way?
Great question. And value-based care is one of those few ideas out there that is universally accepted as being a good idea. Whether you have a national medical system or one more like the US that's distributed, everybody buys into the concept of value-based care. And what it is in layman's term is shifting the healthcare system to a model that emphasizes the importance of keeping people healthy on the front end rather than reacting and prescribing solutions after they've become ill. And what that means is it's a mechanism to reduce costs. So in practice, value-based purchasing and care involves a proactive approach and compensating doctors and medical professionals on what they do on a proactive means rather than doing it again as a reaction to a condition. Obviously, that'll increase patient satisfaction. Remaining healthy is better than getting sick and becoming healthy. It reduces medical errors. It keeps patients informed. It promotes healthy habits. The challenge has been on implementing. And again, it's difficult to implement, especially in distributed environments like the US. When you've got a national medical system, as other countries do, adapting to the terminology and to the payment structures has proven to be much, much easier to move forward than it is in the US. And in the US, I'd still say that we're a little beyond conceptual stage, but certainly not fully implemented. Common definitions become a challenge in a market like the US, as opposed to other markets when you've got uniform streams. The other challenge, and this becomes a little bit of a drawback in a COVID type environment, is you are penalizing physicians for complex conditions. So there are instances where you just can't help people remain healthy in certain environments. There's going to be disruption into patient flow on kind of a massive basis as we're seeing in COVID. So accounting for value-based care or utilizing the value-based concepts as we have today is a bit of a challenge.
Yeah, sort of prevention rather than maintenance. And I know on the outcomes piece, it's we see in the UK wide variations by individual hospital or individual region of the UK for the same treatment. So it's quite important to measure it, but you do see variations. We're coming to more of a way of consumers being able to monitor how effective their medical practitioner is and then choose where they have their surgery, let's say, for example, based on customer feedback and positive reaction and success of the individual medical practitioner, something we've never seen before, a much more consumer choice. So interesting.
Yeah, Barry, and those variations are exponential in a market like the US. I mean, It's just the challenges just get totally multiplied.
Yeah, I can imagine. What are some of the other themes? I know there's been some interesting strategic alliances in the industry, and I think M&A seems to be a particular trend in healthcare. Can you give me some examples of what's happening in strategic alliances and M&A?
Sure, and it really is trending more towards strategic alliances, but we are anticipating significant M&A activity likewise in the future. It's clear that big tech has entered the market. It all started with Haven a couple of years back, which is the consortium that was brought together by Amazon. And there's a lot of curiosity in the market as to where exactly Haven is going to go. Is it going to penetrate and be commercial, or is it just designed for more of internal use with Amazon and its partners? After the introduction of Haven into the market, we're now seeing Microsoft and Google form various strategic alliances. Most notably, Microsoft has publicly announced alliances with both Humana and Walgreens, those alliances are moving forward and more will come available in the public domain as to what exactly that'll mean. But the industry is changing and morphing into a technology industry, and we could expect players to enter the space on a continual basis. Oracle has introduced a healthcare solution for use primarily in the US called OHI, but we also see that becoming a global market that gets penetrated too.
That's fascinating, isn't it? When you think how, as you just said, healthcare becoming a technology, led industry. You got Amazon and Google and Microsoft and Oracle, three brands synonymous with all things technology that we work with financial services and retail and energy and utilities. And the same with healthcare, with those guys taking such an active interest and making such huge investments in healthcare. We are going to see a very, very different industry in a few years' time than we see today, I'm sure. Very interesting.
Yeah, we shouldn't forget about Apple either, who's obviously front and center in developing applications for responses in the COVID-19 environment too.
Yeah, exactly. Yeah, good point. So what about data? Because obviously what they're interested in, I'm imagining the organizations we've just mentioned partly is data about us and on our healthcare outcomes. And what is that their interest? I suppose is my first question. And then and how are they collecting and sharing that data?
Yeah. So what a massive topic. We could probably do an entire podcast just on this topic alone, in terms of, all the various aspects of data. But clearly, healthcare information, right, is being more widely gathered and shared than it ever has been before in the industry. And the industry finds itself at an interesting crossroads, right? To date, right, the Goldilocks principle, right, of share enough, but not too much, right? Just right. That seems to be the rule of thumb in most cases when it comes to sharing data, right? And that's actually kind of a little bit both amazing and scary of what's actually happening out there right now. Some policies are incenting wider interoperability of data, right? But as you would suspect, consumers, right, want and need adequate privacy. Patient access, right, to their consolidated health data has been less than optimal, right? So there's tremendous opportunity there. We've all heard of HIPAA, right? HIPAA has been enacted before this amazing digital revolution going on, right? So it clearly needs to be updated from a regulatory framework perspective. Some out there think that, a holistic approach like GDPR is a better way to go. There's clearly a discussion going on about what to do in the future, right? And then as more and more of this data is being gathered and had, right, the whole topic about data with social determinants, right, of health seem to be incredibly important, right? But do we have the right, are we utilizing that data correctly, and is it adequately protected underneath some regulations? A lot would say no. Right. So then, we just talked about the tech giants getting into the market, right? And they seem to be almost welcoming some legislative action. They are clearly very interested in getting their hands on the data. They are getting their hands on the data. They've got some incredibly innovative projects going on in regards to the data. So what comes of all of that is just, going to be amazing. Right. So I mentioned that they're welcoming legislative action. If you think about it, right, a chaotic market isn't something that you can scale in. Right. And when I say chaotic, there's different arrays of data laws out there. Right. I mentioned GDPR. There's the California Consumer Privacy Act. Right. So these regulations, the use of data, everything around data is going to continue to evolve. Right. A lot say that there needs to be a rebalancing of the protection and the Goldilocks principle I was talking about earlier to account for a lot of these digital advancements. So, if I had to vote, I'd say, hey, U.S. Congress, act now, right? We can only hope that they do, and set some sort of a standard so that whole discussion doesn't hinder the amazing capabilities that we have now with all of these forces coming together and what we can do with healthcare data. Yeah. Overall, though, data sharing standards and the future healthcare policies and legislation, right, will clearly continue to influence this market significantly.
Yeah. Yeah, it's a hugely, again, I think I've said this each time, it's so complex, isn't it? When I think about, my wife has got an Apple Watch, and she works out a lot, and in the gym she goes to, everything is tracked on her Apple Watch, and she logs into the running machine or the bike or what have you, is linked to her health insurance, which gives her lower premiums. But not only that, it gives her free Starbucks and cheap flights. And you think of the data being passed from one to the other, and the complexities of that, but the supply chain and how that is all linked together. And we have a Peloton bike at home, and I love the fact that it's this merge of physical activity with a virtual experience. And I hadn't even thought about it before, but I'm sure when I signed the agreement with Peloton, I probably allowed them to collect data on every workout that we do using the Peloton, which will be used in some way, shape or form. So we're probably giving data away without, it's in an agreement somewhere. I'm sure I would have signed up to it, but sometimes without us even realizing it.
Yeah, and even 10 years ago, I was speaking about these types of concepts, and no one envisioned the propensity of data that would be shared. There were still concerns, and there still are concerns about data privacy, but it has really, really moved and changed. Culture's changing, and this is going to continue to change in the coming years as certain aspects of the population gets older and millennials become more and more involved, where they're willing to have their data harvested if it improves health outcomes.
Yep, absolutely.
I currently have a 70 beats per minute heart rate, real time.
Exactly.
You're
I took my
always
watch
calm,
off just
Jamie.
now. So let's turn to the COVID-19 outbreak then, and have a think about that with regard to the healthcare industry. How would you say that the pandemic has impacted the industry so far? I imagine, obviously it's relatively new, right? It's only been maybe even, it's a matter of weeks. It might be, 6 or 7 weeks we've been thinking about it. But how has it changed, industry priorities?
Globally, the priorities are the patient, number one, the patient, number two, and the patient, number three. The industry's always been patient-focused. It's been a strength of the industry, but with the pandemic, it's become even more acute, and it's all about achieving better outcomes for the patient and trying to stop the spread of the disease, obviously. Some people like to use war analogies. I tend not to, but I guess I will in this case. Providers are the front line of defense in this war, and they are recognized to be so, and the industry and the ancillary industries have all rallied around the providers and trying to get the providers everything that they need to fight this war. Temporary structures are being built across the globe. It's especially prevalent here in the U.S. And a challenge that's not so well publicized is they're not collecting data in a systematic fashion. There are data gaps being created. They're dealing with the priorities of the patient, and rightfully so, but there will be a data gap that generates as we start to try to learn from this pandemic. Payors in the U.S. are stepping up in ways we might not have expected. They're waiving co-pays. They're waiving deductibles. All fees associated with the pandemic are going to be waived by payors. Humana and Cigna started that process, but others quickly followed. I'm not sure they have the systems to implement to support those very altruistic decisions, but they'll rally and they'll figure out how to manage those kinds of commitments that have been made at the CEO level. As far as data is concerned, there's something in the industry that's well known called ICD-10. It's the International Classification of Diseases. On April 1st, that was updated to include COVID classifications, which is obviously a necessary thing that needed to happen. It's going to be a challenge to implement, though, because interpretations of ICD-10 are inconsistent across the globe and within the U.S. specifically. So, for example, Recently, a tidal wave of claims will be coming because of the reclassification of 4,000 deaths in New York alone to be COVID relevant in an ICD-10 classification. So it's going to create some downstream complications as we start to classify claims and figure out who's reimbursable for what in the future.
I mean, it's interesting. I think we're seeing, hospitals or temporary hospitals at least being built in conference centers in a matter of weeks. And we're seeing, big pharma, big competitors. I can't remember who it was, GSK and one of the other big global pharmas start working together this week to think about how they can help to fast track, vaccines. And we'll see vaccine, I hope, being pushed through in a matter of, many multiple months, if not short number of years, as opposed to the sort of decades that we might normally see. So we're really seeing the industry, or the linked industry anyway, come together and work together in different ways. Do you think we'll see the industry changed as a result of the pandemic, or not?
I personally do, and I think those changes will be somewhat great. We see vertical integration starting to happen, and we see moves toward some of these trends becoming permanent. So as companies start to work together, you start to see the identification of natural synergies. So it really looks like it will come out of this pandemic with some better business processes and some better practices.
Yeah, so clearly there's going to be a new strategic plans and investment priorities, right, for a lot of the healthcare management teams that have been managing the providers, right? The reevaluation of supply chains, the reevaluation of alert systems, better intelligence, right? Just a day or two ago, right, we saw Apple and Google collaborating on contact tracing applications, right? We think the security architectures need to be overhauled. We think that there's going to be public-private collaboration efforts, right, that are going to be driving, a lot of the after-action reviews from what's going on here. Clearly, right, the data interoperability, and then the obvious things like, it's a daily story, right, wrapped around how to improve the ability to scale, right, on intake, diagnosis, virtual care, call centers, you name it. So there's a new normal, and it's big.
Yeah, absolutely. And I think that almost there's likely to be a dichotomy, a balance to be struck between, and I mean, this is more than the sort of pharma realm, but you think there's a lot of money to be made by big pharma for finding medicine and then ultimately a vaccine to sort this, which has got to be, counterbalanced with doing the altruistically right thing for the public good to try and, help us, the global population to treat and save lives and cope with the pandemic. And we don't normally see that altruism, I don't think, in the same way. We normally see drug companies trying to make as much as they can from this, right? And I don't think, and I may be wrong, be interesting sort of human nature experiment, but I don't think the drug companies are looking at that or thinking about that right now. They're just working together in collaboration as quickly as they possibly can to try and save lives. Do you think I'm just being naively optimistic in that, or do you really think there has been a sort of shift?
Yeah, no, I'd say there has been a shift, right? And the equivalency, right, with the other wars fought in history, right, where alliances are formed and battles fought, right, in order to achieve the greater good. But
I'm going to be a slight bit more cynical. My take on this is there is so much demand out there. It's exponential, that there is so much money to be made, that as long as the pharmaceuticals and others in the supply chain remain reasonable and don't become too greedy, I think there's enough demand out there to satisfy economic goals in addition to, patient goals. So let's hope greed doesn't yield its ugly head.
Yeah, exactly. So despite the terrible consequences, the things we're seeing, the hundreds of thousands actually globally of deaths we're seeing each day, but that we're seeing right now, hopefully this pandemic ultimately will lead to some positive developments progress and mean that we'll be better equipped to handle future health crises like this. Let's certainly hope so.
Well, there are a few areas that also will come out of this somewhat naturally. The supply chain requirements must be revisited by the providers. This just-in-time methodology that they have for bringing in, medical equipment and personal protection equipment, it's not going to return. I don't think they'll have that just-in-time mentality. There'll be more of a safety stock concept. The work-from-home environment that's affected every industry will remain prevalent, in our view, in the healthcare space. And the effect of regulations. I mean, everybody's taking a look at regulations, especially HIPAA. Or are they too strenuous? Is the data protection requirements and only the ability to access data within a certain location really appropriate in the long term? So in those three areas, we see some practical but significant changes coming.
Yeah, absolutely. So, look, guys, thank you ever so much indeed. This podcast is all about how technology transforms businesses and entire industries, and I think it's pretty safe to say from the conversation we've had that the healthcare industry is an industry that's going through fundamental change as a result of technology. And if you think we've talked about the players and the complexity and the various stakeholders in healthcare and how it's all changing, and the use of digitization and automating processes and the use of cloud and as a service and the collection of data and data interoperability and security and then the themes that we're seeing around alliances and mergers and acquisitions, and then the impact of COVID-19, and then some real positives about the whole industry coming together for the greater good. So thank you ever so much for the conversation. I've really enjoyed chatting to you both. I'm sure our listeners will have enjoyed it too. So yeah, a big thank you from me, and I'll speak to you both again soon.